All right, we have Miss Camreth here today with our friends Dane and Jet. And Miss Camreth was kind enough to want to talk to everyone. And so, Miss Camreth, can you tell us what the kids were struggling with before you came to meet us and what you've noticed, especially since they've been having the light laser therapy overlays?
Yes, so both the boys have very high palates, and so that has created just complications with their breathing. And then they both have the tongue ties, and so we have been trying to progress and function for since they were both born. And so finding Ashburn Children's Ministry, we now know like how to move forward. And so Jet specifically has had some other dental problems that needed to be treated after an accident. Shh, boys, no talking. So having the laser therapy has helped the fascia in the mouth and bringing the jaw forward with the munchie. And so now the speech problems that he has had have been improving. The laser has also been really foundational for him in helping the brain development, the neurological side of it, that is also been a factor. So not only for him has he had the physical limitations with his mouth, but he's also had the neurological behavioral side with it. And then Dane hasn't had so much the neurological side as much as the function, but his palate was very high and gapped. And so we're seeing that close now, we're seeing it straighten, the palate is flattening. So both boys have been consistently making effort with their ability to keep their mouth closed, and so hoping that that will continue to improve as they just get more and more treatment and helping the body change the position and correct.
Very well, thank you.
Yeah.
You mentioned something specifically like after the laser treatment. What are some of the things that you've seen happen that not necessarily were related to the mouth, but right after you come for a laser treatment? Because you do come from very far away and you decided to come more often. What were some of the things that you did notice that made you think, oh, this might be something that would be really helpful for them?
Yes, so the neurological issues that I mentioned specifically for Jet have always been a really driving force in his life. And so as we have seen, as we've gotten laser treatment, we have seen shifts in that we didn't know how to achieve any other way, and breakthroughs that we feel like are directly related to the treatment that he's been getting, and afterwards seeing him progress each time, mainly through speech. There's a lot of speech related, some articulation, but mainly just the expansion of his vocabulary, being able to access more words. And so for him specifically, that has been huge, just seeing the emotional regulation that has come after some laser treatment. And all of those things are just very hard to measure. You can't really put a value or like a procedure on it. It's just, you don't know their individual progress, what it's going to look like. But for him, seeing him being able to cross the midline, those are things that since we've been coming, he's been able to do. Those are huge things that play out in life in lots of little ways that you don't realize that may be affecting them. So giving them that full, it's not just then for the mouth, it's a full body, giving his body what it needs, boys, to make progress and continue to grow and reach his full potential, and like speaking and being able to regulate and have the emotional development that he needs. Yeah.
Very well. Thank you so much.
Yeah.
And if you were to speak to another parent, and what would be the things you would tell them? And they'd be patient, hurry up and wait, or what kinds of words of advice?
Start at birth. Start day one. I mean, a lot of times we don't expect to encounter any problems, and so problems really are a driving force. They have been in our journey, and so I even if you're not so much thinking, oh, this is a major problem, the path that Ashburn can start you on will really be the best way to expand and really reach the potential that's needed. And I mean, learning and all of that follows, you think about those in stages, but for a parent starting at birth, being able to really get this intervention and get this type of worldview, I guess, it really does make such a difference. And so I would just encourage parents to be able to start as early as possible. And like I said, it's been more or less a solution to problems we've encountered. And so now knowing, I wish I would have been able to be here at birth. I so wish there would have been this information available, especially if there's nursing problems, anything related to that, because those are huge indicators that something else is going on, and we often just push those off and think, oh, that's just nursing, or oh, but those are now knowing like it all works together, and so being able to connect that is so important.
Very well. Thank you so much, and I know the boys are ready to go now, but thank you and thank them for their patience.
Yes.
Thank
So
you.
welcome.
We'll see you next time.
Okay.
Bye-bye.